Welcome to another Topic Tuesday. This is Dr. Mike McCall, and we're going to be talking about dairy. So, when I started my chiropractic career, or when I started, it started with school, but after I got out of school was, and I learned applied kinesiology, dairy is one of the things that I wanted to tell my patients can be the cause of their problems. And but let's talk about that from a chiropractic point of view. A lot of times, if you have low back pain and you haven't been moving and you start moving and you start to feel some discomfort, but as you keep moving it feels better, a lot of times you may be sensitive to dairy. So the best way to find out is actually just lay off of all dairy for 2 weeks and then reintroduce it and see what happens. If that doesn't cause any issues, then you probably don't have to worry about dairy as much. There is lab tests out there you can get done with your primary care physician, but there's also ones that you can get from anyone who practices functional medicine, like a naturopath, some MDs, and some chiropractors, where it's a blood spot. You can send it in, they'll check you on dairy. The other part about dairy is, we've really changed the way that we've done dairy since the 1900s. It used to be that you'd have the cows out in the field very close. You would milk the cows, and then we would go ahead and use that milk. There wasn't any need for pasteurization or homogenation at that particular time. But what happens is, as we started to become more cities, we started to put these cows in these big barns, and we started feeding them, and the health of the cow is decreased to such a way the quality of the milk isn't good. So when the quality of the milk isn't good compared to something pasture raised, that the person taking care of it makes sure the cow's healthy, the quality of the milk is dramatically different. So one way to keep the disease out is pasteurization, but what happens with pasteurization is the heat kills a lot of the natural enzymes in there that helps your body assimilate the nutrition. You can't just eat calcium. You have to have, in some cases, an enzyme that helps your body get that into the cells. And in natural milk that's not homogenized or pasteurized, that's there. So sometimes the quality of the milk that we've been drinking in the United States has dramatically changed since the advent of the industrialization of our food. There's a book about it called The Hidden Story of Milk if you want to read more about it. But if you have a dairy problem, it can show up in many ways. It can affect your diabetes because dairy is known to spike up your insulin levels, and you want that to be relaxed. A lot of times it can be the cause of acne. You want to look in there because of the growth factors that are in there. So I've talked a lot that dairy in some cases may not be the right cause for you. The best way to see if dairy is a factor is literally just lay off of it for 2 weeks and then reintroduce it and see what happens to you. So that's the other story of dairy. And I can't wait to talk about the next subject, which I think won't be such a downer. So anyway, we'll see you next Tuesday. We appreciate you watching these videos. Thank you very much.